Hi, I'm Dr. Prue King. I'm an integrative or holistic dentist, a founder and a director at Lotus Health and Lotus Dental in Neutral Bay here in Sydney. So how many of you love going to the dentist? Not many, unfortunately, but however, it is an integral part of your preventive general health program, we believe. And today, in this short time, I want to introduce you to a few key problems that could seriously impact your health and point the way in the direction of solving them. So we look at health from a structural point of view, a biochemical point of view, and an emotional or energetic point of view. We call this the triad of health. And these areas impact all of dentistry and all of general health. And so we break it down into first structural considerations. These might be things like the airway, which Rosalba has already talked about, the importance of being able to breathe fully and properly through your nose, get a good night's sleep without sleep apnea or snoring, so you get a deep, restful sleep. You can concentrate during the day and you're not tired. You function optimally. So dental issues that could cause a blocked airway include a very narrow palate. The tongue can't sit up on the palate and drive the cranial mechanism every time you swallow. It may sit down low in the mouth between the teeth, and then at night time it drops back into the throat and blocks the airway. So by expanding the palate, getting the patient breathing better, you enable them to sleep better and breathe better. Also, if the jaw is sitting too far back, it can block the airway at night time, can cause earache and TMJ or temporomandibular joint issues. So we like to bring the jaw forward, get that in the optimum place. Special interest of mine is treating headaches and neck ache with jaw treatment, positioning the jaw in the right place. It has a particular relationship with C1, C2. So by getting the jaw right, you often affect the neck and the rest of the body as well. We work with ENT surgeons to check the nasal passages in the throat to make sure that you can breathe properly through these passages, because if you can't physically breathe through your nose, then you're not going to be able to convert to nose breathing. So it's very important to have an integrative approach, looking at nutrition, any toxins that might be enlarging the tonsils and adenoids and causing allergies, blocked nose. We also do adult orthodontics, expanding the maxilla, bringing the jaw forward and straightening the teeth. So it's all possible at any age. My oldest patient so far has been 70 years old. So she's very happy with the result. From a biochemical standpoint, then we look at the toxic materials that we can and have in the past implanted into people's mouths, such as mercury amalgam fillings, which contain 50% mercury. What a lot of people don't know is that the mercury from your fillings can also be passed to your unborn child, and it's excreted through the breast milk as well. So anybody contemplating getting pregnant, having children, should be looking at having the amalgam fillings replaced before they get pregnant. This study was done in 1990 on sheep, where they implanted radioactive amalgam fillings into sheep's teeth, and then they x-rayed the sheep 24 hours later, and they found the mercury in the liver, the kidneys, the GI system, the brain, and also the placenta and the breast milk for the sheep. So it does travel around the body, and it doesn't stay in the teeth, as we were told when we were going through dental school. In addition to biochemical issues that could seriously impact your health, I think dental infections are seriously underdiagnosed. Root canal teeth that are chronically infected can be sitting there for years in the bone without any symptoms, and people who are seriously ill with autoimmune diseases, cancer, things like that, should really be looking at their root-filled teeth and whether they are affecting their health. Autoimmune disease in particular are often triggered by infections, hidden infections. Gum disease also can be a hidden infection. You know, we put a probe into a pocket next to somebody's tooth and pus comes out. That's not really a good sign, and yet people live with that for years and years and thinking that they're doing the best thing by saving that tooth, but in reality it's probably not serving them any useful purpose and possibly doing them quite a lot of harm. Other issues that we look at are obviously things like cancer that can seriously impact your health. So we're doing cancer screening every 6 months when you come in to have your teeth checked. And then for the emotional, energetic part of the triad of health, we try to make your visit as stress-free as possible. We use nitrous oxide gas, the laughing gas, and also hypnosis too. So it's possible, if you don't want to have any pain relief, to have a tooth extracted under hypnosis. I don't recommend it for many people, but I have done it for at least 4 patients, and I'm constantly amazed at how the mind is so powerful and can overcome the body. So that is a possibility if you're into mind control. So as I said, it's you might not like coming to the dentist, but it is a very important part of a preventive health program. We can do a lot of screening, we can help you with your general health, and we work with a lot of other practitioners to make sure that you are in optimal health. So if you've got any more questions about dentistry in particular or holistic dentistry, come down and see me downstairs. Thank you.